Hey everyone, my name is Vishruth Puttu, and today I'll be presenting on rising healthcare expenses and their effect on poverty. About me, I'm from Scottsdale, Arizona. I'm a rising senior at Basis Scottsdale, and my interests and hobbies include reading, research, biology, medicine, and playing the piano. Some of the extracurriculars I do include a research program called SEEN at the Arizona State University, and a club that I run called Exploring Emergency Medicine, in which I teach kids techniques such as CPR, injections, etc., that are used in the medical field, and a club that I also use to run food and toy donation drives. I also run another club called Carrying Cards Club with my friends, in which we write cards for children with cancer in a local children's hospital and go and give them the cards. I also, as you can see in the picture, went to Harvard last summer, and I did their secondary school program. And I also do a lot of shadowing. The picture that you can see is attire I wear when I shadow an ophthalmologist here. So yeah, those are some of the extracurriculars I do. And as for my future plans, I intend on pursuing medicine and making an impact upon my local community here in Scottsdale. So a brief introduction into the topic. I started this with an article in the PGHR, and you can go check out that article. It goes into a lot more detail about this topic. And I was really interested in how millions of people around the world, they can't afford healthcare, even if they had access to it, and even if it was nearby. And this issue is truly global due to the universal necessity of healthcare and how this is something that many people around the world are experiencing. The cost of healthcare has been on the rise for the past few decades and is continuing to rise, and many people are going into debt by just trying to pay off their medical bills. So I'll be presenting on the reasons for this increase in developed and low and middle income countries, also known as LMICs. And I'll also be explaining the impact of this increase and how the effects of this increase can be alleviated. So this is just a graph going back to what I said on the last slide about how the healthcare costs have been increasing. So yeah, you can see that overall trend about just how significantly these costs have been increasing. First of all, developed countries, the reasons for this increase. There are two main reasons. The first one is new technologies. So while new technologies are good from a medical perspective, like you can do more advanced surgeries and stuff like that, they're not good from a monetary one, because this is just more that hospitals have to pay for to administer. And as a result of this, hospitals just simply increase the bills that they give to patients to compensate. And in turn, insurance providers, when they get the bills from the patients, they also start increasing their healthcare prices so that they can start paying these increasing hospital bills. This leads to patients having to pay extra to insurance companies and also pay extra to hospitals out of pocket for what the insurance doesn't cover. And the second reason is the lack of competition. So hospital networks, they consolidate into urban areas where they can attract more customers. And this leads to rural areas barely having any hospitals, if more than one. As a result of these hospitals increase prices as there isn't any competition to keep them in check. This also leads to the insurance companies start increasing their prices and customers pay more to insurance and hospitals. But this is for developed countries. So developed countries like the United States of America, for example, they have laws such as the Affordable Care Act, but LMICs don't. So what did they do? Well, they also have the same problem, and there are three main reasons in these countries. The first one is inadequate resources. Their hospital systems aren't developed enough, and they don't have trained individuals who can run these clinics and hospitals. Many regions don't even have health care at all for this reason. They also have to travel really long distances, sometimes even without transportation. The countries can't fund the education of people to become medical professionals also, even if they want to. And there's a factor of brain drain. Individuals who do manage to become licensed emigrate to other countries for better opportunities. They don't have any people who, even if they get trained, to serve in their country also. Second reason is inadequate budget allocation. Most of the spending budget goes toward infrastructure and development in these countries, and billions of dollars are lost to corruption. So there's barely enough money left to be allocated to healthcare because of this. And the third reason is inequality of service. Doctors and hospitals only serve those who they believe can pay them in these countries. So this results in politicians and businessmen being the only ones who can access healthcare. And the rest find themselves even lucky if they can get a physician's appointment. So the overall impact of this, many people, they can't get healthcare when they need it because the insurance feels like they won't pay them. So they have to pay everything through out-of-pocket expenses. and they can't rely on the government to provide healthcare either. So this leads to people putting most of their savings in healthcare and going into even worse poverty and debt. More than 11 million people in Africa have gone into poverty due to this. And globally, 50% of people can't access basic health needs just because of this. And this is not only something that's like in Africa only. Countries such as Afghanistan, Egypt, Iran, Pakistan, Papua New Guinea, Syria, and Yemen face extremely similar circumstances. So the solution at this time, the most ideal solution would be to increase aid to these countries from developed countries, nonprofit organizations, and grassroots initiatives. With the rest of the world helping, LMICs can really have a chance at healthcare, and the people in these countries can really have a chance at a life without poverty and also a life that is with a better quality. But for this to happen, we must work together. Collaboration between countries, organizations, and people is important, and it's an absolute must for this solution to happen. So these are the references I used. So I would like to thank the Global Health Leaders Conference, GHLC, at Johns Hopkins University for this opportunity. I would also like to thank my parents for this continuous support throughout my journey. I would like to thank the various organizations I cited throughout my presentation for the information they provided. And finally, I would like to thank everyone who's listening right now to my presentation. And I hope you guys will think about what you heard today. And I really want you guys to consider trying to make an impact with this issue in your own local communities, and also trying to volunteer with some of the nonprofit organizations. So once again, thank you so much. And if you have any questions or comments about my presentation, please don't hesitate to reach out to me at my email or LinkedIn. Thank you.